Potassium is one of the essential macrominerals the human body needs to support key processes. It is primarily obtained by our bodies from our diets, and its primary functions are sending nerve signals, regulating muscle contractions, and regulating fluids. Small changes in potassium levels can have a big impact on how our bodies function. Potassium keeps our cells' electrical activity going. When these levels fall, low potassium levels in your body can cause symptoms such as abnormal heart rhythms, muscle weakness, and even paralysis over time. What is potassium deficiency or hypokalemia? Potassium deficiency, also known as hypokalemia, is when the amount of potassium in your blood is too low. Normal levels of potassium for an adult range from 3.5 to 5.2 milliequivalents per liter. Potassium deficiency is characterized by potassium levels lower than 3.5 millimole per liter. Any value less than 3 milliequivalents per liter is considered severe hypokalemia. What causes potassium deficiency? Hypokalemia or potassium deficiency has many causes. Common causes of low blood potassium include excessive loss of potassium in your digestive tract. This may be due to frequent vomiting, diarrhea, or laxative use. Excessive potassium loss in urine due to prescription medications that increase urination. These medications include diuretics, also known as water pills, certain antibiotics including amphotericin B and chloroquine at toxic levels, adrenal disorders, such as primary aldosteronism and Cushing's syndrome, excessive sweating also known as hyperhidrosis, eating disorders, such as bulimia nervosa, hypomagnesemia, or low magnesium levels, excessive alcohol use, Little syndrome, which is a disorder that causes increased blood pressure, chronic kidney disease, and genetic disorders such as hypokalemic periodic paralysis and Bartter syndrome. What are the symptoms of hypokalemia? Mild cases of low potassium levels could go unnoticed. However, there are other indicators that could be present, and the first one is constipation. Potassium is essential for transmitting signals from the brain to the muscles and controlling muscular contractions. The intestine's muscles may be impacted by low potassium levels, which could delay the transit of food and waste. Constipation and bloating may result from this impact on the intestines. Extreme tiredness. Every cell and tissue in the body has potassium, which is a vital nutrient. A wide range of body processes can be significantly affected when potassium levels drop, which can result in low energy and physical and mental exhaustion, muscle weakness and spasms. Other muscles in the body, such as those in the arms and legs, can be affected by potassium depletion, which can cause generalized muscle weakness and cramping. Small amounts of potassium are lost through sweating, which is why excessive sweating from vigorous exercise or being in a hot environment can frequently cause muscle weakness or cramping. Tingling and numbness. People with potassium deficiency also experience recurrent tingling and numbness. Potassium promotes healthy nerves. If you don't have sufficient potassium, you may begin to experience needles and pins sensation. This condition is referred to as paresthesia and typically affects the hands, arms, legs, and feet. In more severe cases, the following signs and symptoms of low potassium may occur: lightheadedness or faintness. If you have ever fainted or experienced lightheadedness while working on something, it may be a sign that you are deficient in potassium. Low potassium levels negatively impact energy production as well as the heartbeat and blood pressure. Breathing problems. Breathing issues might result from severe hypokalemia. There are various muscles involved in breathing, most notably the diaphragm. These muscles may not function properly if a person's potassium levels go dangerously low. A person could find it difficult to breathe deeply or feel extremely out of breath. High blood pressure. Low potassium levels can cause blood pressure to rise, especially in persons who consume a lot of salt or sodium. Potassium plays a significant role in blood vessel relaxation, which lowers blood pressure. Sodium levels in the body are also kept in check by potassium. Blood pressure issues are frequently brought on by a diet high in sodium. High blood pressure patients are frequently advised by doctors to consume more potassium and less sodium. Abnormal heart rhythms. Heart rhythm irregularities are another sign of severe hypokalemia. The contraction of all muscles, including the heart muscle, is regulated by potassium in a significant way. Heart rhythm irregularities such as sinus bradycardia, ventricular tachycardia, and ventricular fibrillation can result from extremely low potassium levels in the body. These conditions can be fatal if a person is not treated. Frequent heart palpitations are frequently caused by low potassium levels. Heart palpitations, which can range in severity from mild to severe, can be a frightening experience. It's critical to keep an eye on how severe your heart palpitations are and to modify your diet as necessary. Excessive urination and excessive thirst. The function of the kidneys is to filter waste materials from the body and regulate fluid and electrolyte levels in the blood, including salt and potassium. They accomplish this by excreting waste, and excess electrolytes in the urine. Moderate to severe hypokalemia can impair the kidney's ability to maintain a healthy balance of fluid and electrolyte levels in the blood, which can result in polyuria, an increase in urination. You may also notice increased thirst, known as polydipsia. Severe muscle weakness, leading to paralysis. Muscle paralysis may be experienced by those with severe hypokalemia. When the body's potassium levels are too low, the muscles cannot contract properly and may even cease functioning completely. How is hypokalemia treated? Oral or intravenous supplementation is frequently needed to treat hypokalemia. While eating a diet high in potassium is beneficial, it does not always help to restore potassium levels, which is why it is important to have the patient treated by a doctor. The most popular form of treatment for mild to severe hypokalemia is oral potassium supplements. In rare cases, your healthcare professional might also need to adjust any other medications or address the underlying issues including vomiting, diarrhea, or eating disorders. Your doctor may switch you to a potassium-preserving diuretic if you need to take one. Potassium chloride supplements ought to be utilized to treat both deficiencies since hypokalemia frequently coexists with a chloride deficiency. Then again, always heed the counsel of your medical professional. Unless they're prescribed by your healthcare professional and you're being closely monitored, avoid taking potassium-only supplements. This is because overdosing on potassium can result in hyperkalemia, a condition where excess levels of the mineral accumulate in the blood. Heart arrhythmia, and other serious, perhaps fatal heart problems can be brought on by hyperkalemia. How can you reduce your risk of hypokalemia? By including a lot of potassium-rich foods in your diet, you can lower your risk of having hypokalemia. Your healthcare provider should be informed about your diet. Lean meat and fish, dairy products, legumes, and a variety of fruits and vegetables are among the foods that are high in potassium. Foods that have lots of potassium include avocados, bananas, beans and peas, bran, dark leafy greens, fish, lean beef, milk, oranges, peanut butter, potatoes, spinach, tomatoes. You should seek immediate medical attention if your vomiting and diarrhea linger for more than 24 to 48 hours. A fluid loss may result in hypokalemia. Your chances of preventing it are better the earlier you get treatment. What are the complications of potassium deficiency? Severe hypokalemia can be life-threatening. In severe cases, life-threatening paralysis may develop, such as with hypokalemic periodic paralysis. And that's all for this video. If this video has been helpful, give it a like, share it and subscribe to our channel. Thank you for watching. Until next time.